Last week, we told you how the leading group of OBGYNs want to make birth control pills available over the counter. Well, this week, the American Academy of Pediatrics is recommending emergency contraception be made more available to teens. It would be quite a big change at your child's doctor's office.
Should children discuss their sexual activity with their pediatrician?
I think it's a positive idea.
20-year-olds like Shannon Dewey are young enough to still be seen by a pediatrician, but under a new American Academy of Pediatrics policy, doctors may soon start counseling patients like her and younger ones about giving the morning after pill to them. But the policy goes even further, suggesting doctors give patients under 17 an advance prescription for emergency contraception, like Plan B, so the younger teens can use it if necessary without having to contact them first.
Plan B is emergency contraception that is used within 24 to 120 hours after intercourse to prevent pregnancy. Part of their physical, you would discuss, are they having sex? Many times they'll tell you, many times they won't.
If you're 17, you can get emergency contraception with an ID at any pharmacy. If you're under 17, you need a prescription. Under the new guidelines, doctors can start talking to their patients as young as 10 years old about emergency contraception.
Why 10? It's like immunizations, because you want to do things in advance.
Pasadena pediatrician Dr. John Mangoni says since the U.S. continues to have higher teen birth rates than other developed countries, this new practice could significantly reduce the number of unintended pregnancies. But he's concerned the morning after pill could be overutilized.
We have to figure out what is best for the patient, and we have to make sure that we're just not handing out contraception.
While not every parent wants their pediatrician to discuss sex with their young children, many adults agree educating and counseling kids about contraception can lead to more positive than negative results.
I think I would be a little hesitant as a parent, but if they can explain some things that I might not be able to explain to my child, then I would like for them to be well informed.
It's hard to talk to your parents about these issues, but it's easier to talk to your pediatrician many times.
Now, Dr. Mangoni says he doesn't believe discussing the issue of sex with his patients will necessarily lead to them becoming sexually active. He says if parents want to initiate a discussion with their kids, start by talking about this new policy change and do it in a place where there aren't any cell phone distractions, like in the car.